And I'm Scott Tong in Washington, D.C. This is Here and Now. Some of the nation's biggest pharmacies, CVS, Rite Aid, Kroger, have shared patient information with law enforcement without warrants, without telling customers. That is one finding from a new congressional inquiry. Congresswoman Sara Jacobs was part of that effort. She's a Democrat from California, and she joins us now. Congresswoman, welcome.
Thank you.
So you found that 3 big pharmacy chains gave patient prescription data to law enforcement. Just to understand, they're allowed to do that. Is that right? That is, the law does not protect my medical data from being shared this way?
Correct. So the current laws around healthcare data, the HIPAA Act, allows HHS to make more specific rules about what can be shared and when. And so what we're calling on is for HHS to strengthen the rules so that pharmacies can only release sensitive medical records to law enforcement with a warrant and a customer's knowledge.
What you and other Democrats found in this inquiry is that, and I'm quoting from the letter that you sent to the administration, although pharmacies are legally permitted to tell their customers about government demands for data, most do not. So how widespread is this practice, as best you can tell?
Yeah, so, after the Dobbs decision, Senator Wyden, Congresswoman Jayapal, and I asked 8 of the biggest pharmacy chains about how they handled law enforcement requests for prescription and other health records. And not a single one of these 8 major pharmacies typically required a warrant. 3 of them didn't even require pharmacy staff to contact a lawyer before releasing health information. They just immediately handed it over. Only one of them has a practice of systematically notifying patients of records disclosure to law enforcement. And so these invasions of privacy have major implications, especially now in a post-Dobbs world where, privacy is more important than ever.
Yeah, Dobbs, of course, being the ruling that overturned Roe v. Wade. What kinds of prescription information, as far as you know, are they asking for? Say, patients who have prescriptions for abortion pills or transgender treatments? What are we talking about?
Well, that's exactly right. So they could ask for information on abortion pills, on birth control, on even Plan B, especially because we know some Republicans are trying to target contraception, on gender-affirming care.
On the other hand, attorneys general from red states that, many of them have abortion restrictions, they argue that they need access to some of this information to enforce their state laws. Legally speaking, do they have a point?
Look, we're not saying that they can never have access to this. We're saying that they should go to a judge and get a warrant, just like they do for other forms of information, and that the customer has to be notified. Although I do also have a bill called the Safer Health Act with Congresswoman Anna Eshoo that would ensure that doctors can't share their patients' personal health information related to abortion or pregnancy loss without patients' consent when they're faced with a warrant or a subpoena.
More broadly, Congresswoman, our medical information exists in more and more places. Say, fertility tracking apps on our phones, fitness trackers, Apple Watches, our web searches. How much is that data protected, if at all?
Yeah, so at the moment, that data has no federal protections. And, I use a period tracking app myself. So this is something that I have been thinking a lot about, and I introduced a bill called the My Body, My Data Act, which would create a new national standard to protect reproductive and sexual health data. And I think this is incredibly important, especially this week, as we see the Supreme Court decide that they're going to hear the mifepristone case. And if they decide to restrict access to it, one of the main ways to investigate and prosecute people for taking mifepristone will be using this kind of data.
And mifepristone, of course, being the medication abortion pill. And finally, Congresswoman, you've mentioned the Dobbs ruling. In this post-Roe versus Wade world, what have you heard from women and pregnant people about how concerned they may be about where their medical information is going?
Yeah, so I'm a 34-year-old woman. So basically, this is all I talk about with my friends. Who's having a baby, who's not having a baby, who wants to have a baby, who doesn't. And this is the number one thing that I hear. And in fact, there has been recent polling that shows that abortion is the top voting issue for women heading into the 2024 election. And we know that 2/3 of Americans, including 54% of Republicans, think Congress should act to protect their private reproductive health data. And so this is something that across the ideological spectrum, people care a lot about.
And you mentioned across the political aisle. Are there particular Republicans willing to work with you?
You know, we have a number of Republicans that we work with on privacy more broadly, but of course, as soon as it gets anywhere close to abortion, they tend to shy away, even though I know they actually believe in privacy in all cases. But unfortunately, the Republicans in Congress are not representative of what we know the population actually wants.
We've been talking to Representative Sara Jacobs, Democrat of California. Congresswoman, thanks so much for the time.
Thanks so much for having me.